Hi, welcome to Acupuncture 123 and Acupressure 123 live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now, today's our topic is how to use acupuncture or acupressure to instant relieve chest pain. The reason I want to talk about this is because I went to my friend's house today, and because she just had a baby. Couple weeks ago, last week, I think. Last week, sorry, not couple weeks. Yeah, last week. It was about a week. Then her mom came over from China. Okay, and I remember the last time that her mom came over. I never met her mom, and then this is I think it's about 3 weeks ago. First time I met her mom, and I knew that mom suffered from chest pain. She had a heart attack when last year when she was here. She had a heart attack and went to the hospital. So she's on medication for that as well. So even though she had medication for that chest pain, and when it's happened, it's scary. They have to go A&E. So this is but she's on medication, but she still have pain every day, a little bit of pain, tightness. Now, if you suffer from tightness or pain like someone grab your heart, or just stiffness, or even it's not tightness or pain, you just feel uncomfortable in your chest. Any of that. Now, today's topic it is for you, or any family that you have suffer from that, or you an acupuncturist. Hey, today's topic is for you. So if you're on my Facebook or YouTube, share this message to your friends or your whoever you care who have chest pain. If you're an acupuncturist, share this with your colleague as well. Because what happened is, I'm going to show you this point. In this point, you're going to use one of your fingers or acupuncture to needle it. Either way, it will work. Okay. So my patient, my friend's mom became a patient. So she told me today, after a week of miss acupressure point, she has no longer had any chest pain, just for a week of acupressure massage. That's it. Which she had a chest pain for a long time, over 10 years. And she was on medication, and when it's worse, she need to go to hospital for A&E. It's just a simple point that she just need to massage every day, 3 minutes. I show her 3 acupuncture acupressure point. Now today I'm going to show you just 2 points. For those 2 points, you need to know how to locate it, because location is very important. Location is the most important. Okay, and into the point is the most important as well. And what technique should you use is important too. All right. So in here, now the point is in here. So this is your hand. I think I showed another video already, but I want to show you again because this is important. I want to put acupuncture and acupressure together. So if you're not an acupuncturist, so you know how to use acupressure to apply on those points. If you're an acupuncturist, you know how to needle it. All right. Not just on one point, you need to know how to locate, how to find a point. Okay, this is the most important one. So on the crease, on the palm side, on the crease, it's just from the forearm. All right. So in this is the crease of the wrist. Okay, 3 fingers from here down to here. So on this level, this is pericardium 6. I know you know pericardium 6 is in the middle, right? But I want you to do something. I want to let you know, not just in here. So when you put 3 fingers, this is the line, the level. This level, I want you to match the middle fingers. Okay? So over here and here. So you see, I have 3 levels now. So first, this is the level, and match this level onto your middle fingers. 3 level. So in this 3 level, in general, the pericardium 6 is in the middle of here, about between 2 tendons. If you want to find the 2 tendons, you have to bend your hand a little bit, and you can find the 2 tendons. Some of them very close, some of them wider. So at between. So at between here, this is pericardium 6, but what I'm going to show you is not just in this point. You have to compare this one and next to the tendons on the little finger side, and the other side on the thumb side, right? If this is the 2 tendons, you're going to feel 2 tendons in between. There's one in here, one on that side, one on the other side. So one on the thumb side, one on the small finger side. Okay, so that become 1, 1, 2, 3. Then you see 3 finger in here, right? So you have 1, 2, 3, 4, 5, 6, 7, 8, 9. So put it in here. You see, we have 9 points. You just need to use your fingers to compare which one is the most sensitive one. When you get to the most sensitive one, that point, you need to press it and give it some massage for about a minute. You count to 60. So I suggest you use your knuckle. So your index fingers like this, bend it, and use your thumb to support it, right? And you go along to find and see which one. So my one is, you have to compare the 9 point of them, okay? So my one is more in here. It's not actually on the pericardium 6. It's up in here. It's more close to the lung meridian. So this is the most important, sensitive one. So I press it and rub it for about a minute. That's it. That's it. If you have time, you can do all the sensitive point. If you don't have time, just choose one point, the most sensitive one, work on it. Okay, once a day or twice a day. I just normally say just once a day. So your aim is get rid of all the tension spot. If you're an acupuncturist, what you're gonna do is, you know, in school or some master probably tell you that you needle the pericardium 6, right? When you needle pericardium 6, you have to do strong stimulation, right? So you may get to the nerve and get a lot of sensation in here or in here. That's because when you do a strong stimulation, it got all the sensation around here, so it can treat all chest pain in here. But if you just needle one point, hey, it may just should, oh, the patient say a bit better, but still there. Now you need to do technique. But this is a bit painful when you needle it, especially when you get to the nerve. That sensation, I don't know if you try or not. My patient, myself, I don't like it. But if there is a way that you will help patient, but the patient will feel comfortable, would you want to do that? Yes, of course, right? If the patient's in pain, they don't care if you do a strong stimulation. But if they come back, they feel a little bit of pain, or they have no pain at all, you want to keep treating it and use strong stimulation. They don't want to, because there is no pain now, and why do they have to suffer pain from needle to treat the chest pain? You see what I mean? So you can do few more needles around here. So get the most sensitive one and put more needle. Okay, you can put 9 needles 6 needles or 3 needles, whatever you want. You put a few more needle, get the most sensitive one, put 1 needle, and put few more needle on the side. And then you don't have to put strong stimulate the needle, and it will still work perfectly. Get the whole chest done. Okay. Now, if you're not an acupuncturist, just use your fingers, use your joint to massage it for 1 minute. Okay, it's very simple. All right. Now, the next point that I want to show you is Hergu point, which is large intestine 4. But this is not on the large intestine 4. I want to let you know, because people get large intestine 4, but they didn't get it right. Okay, it's actually between large intestine 4 and 3. Okay, between 4. How do you locate the point? Okay, locating the point is very important. So you use your thumb. You can see the crease on your thumb. This is a quick way. Okay, and the crease when you open your index fingers and thumb. So you see the crease over here. So over here, I want to let you know. On YouTube, you can see this crease here, right? And on Facebook, that you can see in here, that one. So you want to match this with this line, okay? When you match it and you put your fingers in there, that is where the point is. Your thumb is where the thumb is large intestine 4. But you want to move from here toward to here, toward to your fingers, okay? Next to the bone, okay? Second metatarsal bone. This is the first metatarsal bone, second metatarsal bone. So I want you to locate, okay? Just move it a little bit from the center and here, a little bit, a little bit, a little bit. So you can probably get 3 to 4 points. 2, 1, 2, 3, okay, even 5, 4, okay? So when you move your fingers, you don't want to move that far, okay? Just move a little bit to locate the point. And what you're going to do, if you press it like this in this angle, you won't get any sensitive point. You want to press it toward to the bone, toward to the bone. The best way is use your hand like this. I don't know whether you can see it or not. So hand like this. So hold this hand under here. If you do it yourself, just do it like this. Can you see it? Okay, just like this. All right, just like this. And toward to the bone. Okay, not on the bone. If this is on the bone, this is the bone. You're not doing it in here. You do it on the side. You see? You do it on the side. Not doing it in here. If you do it in here, it's on the bone, not on the bone, on the side of the bone. Okay, this is where the point is. So along here, get most sensitive one. Then press it again. 60 seconds, a minute. Count to 60. That's it. All right. So those are the 2 points that I show my friend's mom to press it every day. I told her just once a day. Just once a day. Doesn't matter morning or before bed. I said do it before bed. Then what else? I show her 3 points. The other points on the foot, but it doesn't matter. I just want to show you 2 points today. If you learn those 2 points, good enough. It's good enough. Just do it massage every day. And when you have pain, do it straight away. Okay. If you don't have pain, just keep it once a day. Only 2 minutes. Only 2 minutes every day. Then your aim is to get rid of all the sensitive point over there. Whatever you can find, if 9 point in here, you can find it sensitive. You want to get rid of all the sensitive point. Once you get rid of it, you need to press harder and harder into the bone to find that you want to get no pain, no sensitivity over there, over this point and this point. Okay, so if you have pain, do it straight away. Do extra. Okay, if you don't have pain, just keep it once a day. Then you want to keep it a while, just keep going every day for years. Okay, so normally we move 1 point, it will take for months, 3 months, 6 months, something like that. All right, Again, doing the acupressure point, it'll good for pain, relieve the pain. It'll good for the blood flow into your heart area, chest area. But heart problem, diet. You need to watch your diet. What do we recommend for our patient or patient? Vegan diet. A vegan diet is the best, because what happened is one of the iron that you get from meat, okay, it actually the iron from plant it has hemo heme iron, non-heme iron. If you get from meat that iron, that it'll make your heart problem or get your stroke. Okay, it's not good for your blood and not good for your heart. Okay, this is on the Western side. So I introduce, and that is so much benefit for vegan without meat, okay, and dairy, and they are not good. So I just show a documentary about 104 heart surgeon, years old heart surgeon. He is vegan, and he tell people to become vegan. And there's another heart surgeon. He asked people to get low-fat vegan diet, and he saved a lot of people. And what the question for them is, they keep getting patient cut open their chest, and they say, well, they can save them, just they can use bypass and save them, but the symptoms still there, and they'll quick come back again, all the symptom, and then they can't do each time, they can't do open heart surgery all the time. So, and they give them drugs, and the drugs won't prevent it at all. That's what they say, the surgeon, professional, they say that. And what they found out is the only way to go with is vegan diet. So this is for the symptoms, right? It can strong your heart function, but what you eat is important too. We're gonna do more video about diet, all right? So I hope you get it. I hope you follow the point. Do it when you have no chest pain. Don't be too happy, because you need to change the diet, because those things will keep coming back to you. Okay, changing diet is number one. Okay, change your lifestyle. All right, you stay awesome, and I love you all. I'll see you another day. See you tomorrow. See you. Bye bye.